Hi everyone. I am just getting home from work and Chase is here playing on his tablet and Devin is over in the our little play yard doing his thing. I just wanted to talk to everyone about thumb sucking. I've been seeing a lot of patients lately who have kids that are sucking their thumbs and they're allowing it to go on, and they just don't know the damaging effects of thumb sucking. So just wanted to go over that. I do apologize if I'm talking a little bit funny. I am in Invisalign treatment and I am almost done. Teeth are almost super straight, so I can't wait to complete that journey. Highly recommend Invisalign. It's awesome. Anyway, let's talk about it. So my son, Chase, there he is in the background there, has been a self-soother since he was born. And what do I mean when I say self-soother? I mean he was able to soothe himself to sleep, to just soothe himself in general. He wasn't like a big crybaby. And the reason this was the fact that he would suck his thumb. That was his thing. Actually, we have an ultrasound picture, and in the picture, Chase has his thumb in his mouth. Like, it is like real. Okay, he's been doing it for forever. So, as a hygienist, I know the severity and the damage that can be caused from that. So we tried everything to get him out of sucking his thumb. And when I say everything, I mean everything. We started by putting different ingredients on his thumbs. So aloe, and just everything. It would not work. So finally, someone recommended Movalistop to me, although we had to wait a little bit because they have to be a little bit older to use it. This is what it looks like. Movalistop. It tastes horrible. Before applying it to Chase's finger, my husband and I, we tried it, put our finger in our mouth. The taste is terrible. But guess what? Chase still sucked his thumb. It was not strong enough to stop him and to stop the habit. So we did some research. And also the thing with Movalistop, the reason that you're supposed to wait until they're a little bit older, and when I say older, what does it say? Yeah, 3 and up. The reason you're supposed to do that is because your child's taste buds aren't fully developed yet. So trying it at a younger age, it might not bother them at all. Pretty much. So that didn't work. So we kept looking, kept researching, trying to figure something out. We ended up finding this. It's a godsend. It's called Dr. Thumb. And what it is it's a little, you put it on your child's hand, you stick their thumb through, and then it kind of crosses over their palm. And it prevents them from getting that latch, that suction on their thumb. So it's perfect. And it actually, I have to say, we got it for both hands. It worked. My son stopped sucking his thumb. We were happy. Life was great. It did take about 3 days before he stopped showing interest in sucking his thumb. It didn't take too long. But lo and behold, one day I went in his room at night and I heard that sound. I'm like, what is going on? I look in his crib and my child has his pointer finger in his mouth and he is sucking away. So then he switched from his thumb to his pointer finger. Although, the downside is that there's no guards for your pointer finger. So we're like, great. What do we do now? We've tried everything, guys. He still sucks his finger to this day, and he just turned 4 on Thanksgiving Day. I brought him to my job to see the dentist, and she was very concerned with his occlusion because it's totally off and affects his speech. It's very hard for him to say things. It's very hard for him to enunciate his words. Sometimes it's hard for us to understand what he's saying because of the severity of, the positioning of his teeth. So what I did was I borrowed a Typodont from my job. So this is pretty much what you use, what we use in the dental world to explain things to patients if they're having a problem in a certain area, if they need to brush more in a certain area. This is what we use to kind of demonstrate, you know, what's going on in the mouth, because people have no idea what's going on with their teeth, literally. So sometimes they need a visual representation. So this is what we use. This is a child's type of knot, 20 teeth in total. But what I want to show you guys is the issue with the pressure that's placed on the teeth when they're just coming in and the mouth is still developing. So, for example, when someone sucks their thumb, they're putting pressure on the tooth, and it pushes the teeth out. So if you look, this is how it is. It pushes their teeth out, just kind of like that. And the issue also is that it pushes the bottom teeth inward, and it just causes all types of problems, okay? Now the issue with my lovely boy there is that he sucks his finger. So he puts it just like this, and this is how his teeth are. So we'll have to wait until he's about 6 years old to get him a device, possibly a palate expander. I don't know what they're gonna do to fix it, to be quite honest with you. And I work in the dental field. It's pretty severe at this point. Baby, can you come? You come say hi. Cheese. Let me see those teeth. Yes, my sweet baby. And he just has like a little bit of a speech impediment from it. It's really hard for him to talk. So bottom line, moms out there, new moms, any mom, if you have the pacifier as well, take that thing away, because at that age their mouths are very impressionable, and you can cause malocclusion that later down the line is going to cause lots of problems, lots of money to fix these problems, severe trauma, severe damage to the occlusion. So don't let your kids suck their fingers. Try to break the habit while they're small. Pacifiers, take them away. It is not worth it. I'm 27 and I'm wearing Invisalign. Please take it from me. Have a good night, guys. Just trying to give you some tips on teeth.